In Humphrey Visual Field Analyzer printout, the false positive responses implies that the patient has pressed the response button, despite no stimulus being seen at the time of response. Swedish interactive thresholding algorithm testing program is based upon the detection of patient's response during the test. If a response occurs too early to be physiologic or too late based on the patient's average response time, it is considered to be outside the response time window and thus labeled as a false positive response, and false positive rates more than 15% are flagged. This visual field is a classic example of a trigger-happy field of the right eye in a healthy optic disc. It shows high false positive of 76%, increased fixation losses, high threshold sensitivity values of up to 50 decibels in raw data, white patches in the grayscale map known as white scotoma, high positive mean deviation value of plus 14.5 decibel. A message of excessive high false positive is displayed. Glaucoma hemifield test has a classification of abnormally high sensitivity. Total deviation numerical plot has high positive values, and pattern deviation probability plot has more defects than the total deviation probability plot, which is known as reverse cataract pattern. However, these classical findings are not seen in all the cases of false positive, as the same thumb rule cannot be applied to all the visual fields with high false positive. I would discuss some interesting visual fields in normal and glaucoma patients and the effect of high false positive responses on mean deviation, total deviation probability plot, and pattern deviation probability plot, and the different classification messages displayed for glaucoma hemifield test. This would highlight the importance of careful examination of all the parameters in a visual field printout to interpret the test results. This 24-2 SETA standard visual field printout of the left eye of a patient with advanced glaucoma has a false positive rate of 26%, which is flagged. A message of excessive high false positive is displayed. Mean deviation has a negative value of minus 24.04 decibel, and the glaucoma hemifield test classification is outside normal limit. Total deviation probability plot is worse than pattern deviation probability plot. If we look at the numerical values, the patient has responded to some of the stimuli presentations which were not to be seen, as shown in the subset of test points, which does not show very high test sensitivities at this location. Hence, the white scotoma is not seen in the grayscale. A year later, when the test was performed, the false positive has reduced to 10% and the visual field correlates better with the disc findings. This visual field of the right eye of a patient with glaucoma has a false positive rate of 23%, which is flagged. A message of excessive high false positive is displayed. Mean deviation is minus 16.67 decibel, and the glaucoma hemifield test classification is outside normal limit. Total deviation probability plot is worse than pattern deviation probability plot. This is another example of false positive response seen in glaucoma patients. This visual field of the right eye of a normal person with a healthy optic disc has a probable nasal step. The visual field has false positive of 17%, which is flagged. A message of excessive high false positive is displayed. Mean deviation is minus 1.32 decibel, and glaucoma hemifield test classification of borderline is seen. Total deviation probability plot is slightly worse than pattern deviation probability plot. In numerical data, it is noted that some of the peripheral points have threshold values of 33, 32, 30, 31 decibel, which is similar to or higher than the central points and obviously not physiological. This visual field of the right eye of a normal person with a healthy optic disc has a false positive response of 23%, which is flagged. A message of excessive high false positive is displayed. Mean deviation is minus 2.05 decibel and GHT classification of within normal limit is seen. Total deviation probability plot and pattern deviation probability plot look similar. This is because all the points probably show uniformly elevated retinal sensitivities, though they are not in the supernormal range as seen in the classical trigger-happy visual field. A higher number of significantly depressed test points in pattern deviation probability plot than total deviation probability plot is one of the classical hallmarks of a trigger-happy field. It is interesting to see that the same is not seen in the different case scenarios. One should be cautious when a false positive response is noted in a patient with advanced glaucoma, as the retinal sensitivity values may not be in the supernormal range but are significantly affected by the increased false positive. Clinician should be able to identify this and repeat the test, as high false positive can lead to underestimation of visual field loss.